Fighting Ebola is hard, but in the Congo mistrust is making it harder. When Ebola first struck this city of more than 100,000 people last September, many here didn't believe it was real. As the disease latched onto families and spread through tightly packed neighborhoods, rumors began spreading of organ harvesting and political conspiracies, even as more people got sick and died. When the ambulances came to take people away, they would never see them again. They fear. It's this extreme mistrust, along with simmering conflict and what many responders on the ground believe has been a flawed response, that has allowed the world's second biggest Ebola outbreak on record to continue unabated more than 10 months after the first cases were found. Despite millions of dollars in funding, and an effective experimental vaccine, Ebola is spreading to new parts of Congo's North Kivu and Ituri provinces and re-infecting areas thought rid of the virus. This month, its Butembo's residents live at the frontier of a conflict that the world often forgets. Hemmed in by multiple armed groups that commit repeated atrocities and harassed by the national military frequently accused of human rights abuses, they are famously and understandably distrustful of newcomers. Earlier this year, unknown assailants destroyed Ebola treatment centers in Butembo. In April, because of these security concerns, the White House barred world-renowned specialists of the U.S.-based Centers for Disease Control from setting up a base in the heart of the epidemic, although it does have staff based in the regional capital Goma. Similarly, faced with an epidemic that is in continued violence targeted at the response, health authorities are urgently searching for a different strategy to stop Ebola. During a draft internal World Bank assessment on the response from late May seen by CNN, describes the mounting shock at the rising death toll. Alarmed. It describes a response top-heavy on operational costs like salaries and hazard pay. More than half of the we. Christian Lindmeier, a spokesman for WHO, says the organization is committed to the people of the DRC affected by the disease and that every key aspect of the response was labor-intensive. As we. Alima, the French NGO, believes it has found a solution to the mistrust that has stopped people seeking treatment. It's both hidden and a thermometer and a quick consult separates incoming suspected Ebola cases from other patients. Community members were brought in and consulted at the beginning of the construction. There are no alarming Ebola warning signs and posters. It just looks like as. But to the frustration of Alima, it is the only reception center of its kind in Butembo. Plans to build this innovation in treatment means if Ebola victims are identified quickly and get to treatment centers from reception centers, hospitals, or clinics, they have a much better chance of surviving. To make treatment easier and less intimidating, Alima has developed what they call a during and after the devastating Ebola outbreak that spanned several countries in West Africa from 2014 to 2016 and killed more than 11,000, the WHO faced for acting too slowly and warning the world too late. In response, the Global Health Agency reorganized its emergency response structure and strengthened its operations. But in this outbreak, at least according to the responders we spoke with on the front lines of treating Ebola, it hasn't worked as planned. David Gressley, freshly appointed by the UN as an of sorts, says the Ebola emergency response has gone through a major reset in recent weeks in the wake of internal criticism and a mounting death toll. If CDC's Dahl says that the which, while experimental, has been found to be in the Congo, has led to complacency and the legwork of tracing patient contacts and quickly isolating them has not been done thoroughly. But He says around half of cases are still unknown to the contact lists, and a large number of positive cases are deaths in the communities from people who wouldn't trust or couldn't get to early treatment. Contact lists allow epidemiologists to ring-fence an outbreak. When a positive case, to get this outbreak under control, the CDC says more than 70% of cases need to seek treatment early, and upwards of 80% of cases need to be on the contact lists. Otherwise, Samuel Mutawa was unemployed when the virus hit Butembo, but when the outbreak hit he volunteered to help. Now he plays armed only with a thermometer, he leads his contact tracing teams through the neighborhoods of Butembo. Twice a day Mutawa entered the compound of a grandmother and grandson that visited a sick friend in hospital. The friend later died, 36.8. But earning the trust of his own community has been a hard-fought and dangerous process. In the early months, Ebola is an intimate disease that is highly contagious but only contracted through direct contact. It attacks families and then spreads through communities, often through so-called super. It is often the personal choices of Ebola victims that can have an outsized impact on the transmission chain. When the sister of Roger Mumburi Wasukundi, 17, got sick earlier this year, he says nobody wanted to believe that she had Ebola. They didn't even believe. After they buried his sister, his aunt got sick and quickly died. Roger, his mother, He still dreams of being a lawyer, but the virus still affects his health, his eyes clouded by the after effects of Ebola. He believes that survivors like him can help turn the tide in the fight against Ebola and dispel the mistrust that has made the disease so hard to beat. Ebola.
Raindrop, drop top smoking, no cooking the hot pot. Fucking on your bitch, yeah, that. Looking up, open the park pot.